Hello, thank you for having me.
No, thank you for being here. Please take a seat. Why don't you start by telling us your experience with this oral lesion you found?
Oh yes, so where do I begin? Well, it started when my patient came in to get her oral lesion checked out. The appointment started out normal. I began to ask her about her medical history, and she said, oh, I told her everything. Everything stayed the same. There was no change to my medical history. She was quite polite, but she kept asking me more questions just about my age, if I'm still taking medication, stuff like that. Well, yes, I did begin with her age. She is a 50-year-old white female who does not consume any tobacco products, but did admit to drinking alcohol such as wine on the weekends. She is taking medication for her hypothyroidism, but other than that, she looked pretty good. She is considered an ASA Category 2 due to her hypothyroidism. Hypothyroidism is a common thyroid disorder where the thyroid does not produce enough thyroid hormone, which can cause oral manifestations such as xerostomia, lichen planus, burning mouth syndrome, delayed wound healing, salivary gland enlargement, increased dental caries, and more. But she is taking Synthroid for the management of this condition. I then asked her questions about her oral lesion, like if she was aware of the lesion, and then she said, oh, yes, I told her yes, that I noticed the lesion like 3 years ago, around the same time that I started using my night guard. Yeah. I also asked her if she felt any pain, burning, or itching, and I also asked if it had grown since the first time she began to notice it. Her response was no to all of it, and she started to show me right away. This is what it looked like. The lesion was found on the right lateral border of the tongue. Its distribution is localized unifocal, with having well-circumscribed regular borders. Its size in centimeters is 0.3 by 0.3 centimeters. It is light pink in color, and the shape looks to be of a round elevated lesion with a smooth surface texture and a firm palpable consistency. There were no radiographic findings, and the patient had also said that she had no previous treatment for the lesion. However, she did claim that a doctor took a quick glance at it. Differential diagnosis. I then came up with a list of my differential diagnosis, one being a traumatic fibroma. A fibroma is a broad-based, persistent, exophytic benign lesion composed of dense, scar-like connective tissue containing few blood vessels. It occurs as a result of chronic trauma or an episode of trauma. It is also known as an irritation fibroma or traumatic fibroma. Fibromas are generally presented as slow-growing, well-demarcated growth, usually with normal-colored mucosa and a smooth surface, sessile or pedunculated base with a hard consistency. I considered this a possible diagnosis because of the similar characteristics, and because my patient had said that when she started using a mouthguard, she began to notice the lesion. Then she also said that sometimes she likes to mess with it, and both these things could have caused irritation and trauma to the tissue. Here we have a picture of my patient's lesion on the left compared to a traumatic fibroma. My second differential diagnosis was a mucocele. A mucocele is a lesion that forms when a salivary gland duct is severed and the mucus salivary gland secretion spills into the adjacent connective tissue. I considered this a possible diagnosis because my patient is shown to have hypothyroidism, and one of the oral manifestations I had previously said was salivary gland enlargement. This could have ruptured, causing spillage into the adjacent tissue, which may have caused a mucocele. However, this was not the correct diagnosis because a mucocele has a different appearance, somewhat of a cyst-like, painless, fluid-filled, bluish, bright red swelling that is most common in the lower lip. Here to the left, we have a picture of the patient's lesion, and next to it, an example of a mucosal. Now for my third differential diagnosis, a neurofibroma. A neurofibroma is a benign tumor derived from Schwann cells and perineural fibroblasts, which are components of the connective tissue surrounding a nerve. The tongue is the most common intraoral location. I consider this a possible diagnosis because it is painless and usually appears as a sessile nodule that can be most common on the tongue. However, this was not the correct diagnosis because neurofibromas are characteristically associated with multiple lesions elsewhere in the body and can present with symptoms such as airway obstruction, difficulty swallowing, mastication deficits, or cosmetic distortion of the face. Again, here we have a picture of our patient's lesion to the left compared to a neurofibroma of the tongue. Management plan.
How do you plan to treat this patient accordingly based on her individual needs?
Well, after advising with the doctor, we did agree that our patient had a traumatic fibroma. The management plan was to refer the patient to have the lesion surgically removed and biopsied, to then schedule a follow-up here with us or with her dentist.
Well, that's all the time that we have for today. Thank you for presenting your Grand Rounds presentation.
No, thank you. Bye. References.